All right, here we are. Thank you, everybody, for tuning in on this very special presentation here on Fix Network. So we have a special guest today, Dr. Christophe Merville from Boiron, and Boiron is obviously a big Fix sponsor. Oh, hold on, let me just turn my phone off because it's making noise. Sorry about that. So as we were, so Boiron, of course, is a world leader in homeopathic medicines. And Dr. Merville has been a director of education and pharmacy development there for quite a while, and in the organization since 1990, I believe. So you've had a long career already in the industry, and I look forward to, well, learning more and picking your brain a little bit about this, about homeopathy and how indeed it is the sports chiropractor's secret weapon. So welcome, Dr. Merville. Pleasure to have you on board.
Thank you so much. Thank you for having me.
No, that's all right. Good stuff. So I believe you are in Philadelphia, there in America at the moment.
Yes, absolutely.
Absolutely.
That's where I live.
Yeah. Is that the Boiron HQ there as well?
No, that's the headquarters of the Americans, U.S. Subsidiary. Our headquarters are in France.
Oh, okay. Well, hence that would explain a lot, because of course you being French and then somehow ended up in the States.
Exactly.
Very good, very good. Hey, so obviously you've had a long history in terms of publishing papers and even developing the Boiron Medicine app and all kinds of exciting things. Can you tell me a little bit about the app? Because I'm sure our listeners would love to hear about that.
Sure. The app was designed for every person relieve to relieve conditions that are not grave, not severe, not life-threatening, like common cold, stress, you know, joint pains, and so on. So you do not have to know anything about homeopathy. You can use the app, and in a few clicks, entering the main symptom, a few other questions about how you experience your symptom, you get a protocol with the medicine, how to take them, the warnings, and you can email it to you, back to you, or to your retailer to get the prescription fill if you want. But those medicines are not on prescription; they are over the counter, and can be easily obtained even online. So it's quite easy. So only for self-limiting conditions, things that you can safely self-medicate.
Oh, that sounds really cool. Now, I have to confess at this point, that my knowledge on homeopathy is limited or superficial at the best. Um, I've known about homeopathy for a long time, and I do refer patients to homeopathic doctors here in the UK as well, because I know it works. Um, I understand, there has been some discussion as to how homeopathy works. So is that something you would like to briefly address for us, please?
Yes, it is very interesting. We start to have some clues about the mode of action of homeopathic medicines. The first thing of course, that is really difficult is most of them, not all of them, but most of them are diluted, and it is hard to measure the quantity, the exact quantity in the solution. However, there are very interesting models looking at the physical properties of these dilutions or the biological properties on animal tissues, on bacteria, on plants, showing that between water that has been purified and treated the same way and a homeopathic dilution, you have different outcomes. So we think that homeopathic dilution stimulates specific biological pathways and trigger by a system of virtuous circle, by a system of amplification, triggers the physiologic response. It is the best possible explanation so far. Each medicine has a different mode of action. The most popular medicine, called arnica, the one that every chiropractor should have in his cabinet. We know that it triggers the transcription of genes coding for inflammatory mediators that could explain his action on pain and swelling. So that is, it's preliminary. We begin to understand details of the mode of action.
Okay. Now, so again, maybe for some listeners who have never been exposed to homeopathy before, so are these liquids, or do you take like capsules? How does that work?
Well, they are because they are drugs, at least in the US. I don't know exactly this. I think there are drugs also in the UK and many other countries like France and so on. But a drug, you present the drug in a form that's suitable for absorption. So most of homeopathic medicines are presented as sublingual pellets or tablet, meaning you put them in your mouth, let them dissolve, they go directly in the bloodstream through the mucous membrane of the skin of the mouth, and that's where they work. You have also topicals, the cream gels, ointments you put on your skin. You may have suppositories. You may have liquids for people who cannot take the pellets. But the main form is really sublingual pellets.
Okay, so that sounds very user friendly. That
Yes, no
absolutely.
injection.
No, quite. No, I think most of us could do with a few less of those, in all honesty.
Oh yeah.
No, good, excellent. So hey, let's get to the sort of meat and bones of today's discussion, which is the how homeopathy can be the sports chiropractor's secret weapon. So what's the angle here? I'm curious.
So here, I have two. Homeopathy can really make a difference in two situations. The first situation is when patient is, of course, suffering. You know that even with chiropractic, it is not always working instantly. And during that time, you want to promote relief, but also you do not want to cause any side effect, any other pain. And that's where homeopathy is a nice tool to be used. So even if your patient has a chronic treatment, and you certainly do not want to recommend something that could interfere. I know a lot of supplements and herbs could interfere with the main treatment. With homeopathy, you don't have that risk, precisely because most of them are too diluted to interfere with other treatments. So that's one thing. The second is in particular situations like physical therapy, for example, you have a couple of medicines that are really very well suited to help the patient overcome, for example, the initial pain and stiffness when physical therapy starts. And that's where you if you have a tube of the name of the medicine is Rustox, and you give 5 pellets before starting the session, you really can help for the first 15 minutes the patient to increase the range of motion without too much pain.
Oh wow.
So there are medicine like this that are interesting for sciatica pain that you can use right away when the patient comes in, and within minutes, okay, range of motion, comfort increases, and then you can really do what you need to do with the patient without having to fight the pain and the fear of the pain.
Oh yeah, absolutely. No, that's something that, of course, all of us practicing chiropractors, we know all too well. When the patient is maybe the pain is 3 out of 10, but then the anticipation of further pain, it makes it 9 out of 10. So no, that kind of thing which sounds amazing. But I mean, I'm quite puzzled as to how does it work so instantaneously?
Well, first of all, you take them in your mouth, they dissolve in a few seconds, 30 seconds, and they go directly in the bloodstream. So you don't have to wait until the tablet dissolves in your stomach, which can take 30 minutes, and so on. And when you choose the right medicine, that's where the medicine finder is convenient. The action is quite fast. Uh,
Yeah.
Another application I told you about arnica, but a patient who is in great deal of pain, of course, now Western civilization, we turn to painkillers, to pills, and so on. And with homeopathy, you can increase the pain threshold. That means it will take the patient will need less frequent doses and lesser doses if painkiller is combined with homeopathic medicine.
Oh, I
So you
see.
decrease the side effect and the just because you decrease the dose of painkiller, because there is another situation. And another
Yeah.
advantage that I really like is that if you homeopathy allows the patient to monitor their treatment. They can take homeopathic medicine at any point and from every half an hour to 3 times a day or less, but
Mm,
they know they can take it without side effect, without risk, and that allows them to have control on their
mm.
pain, which in itself decreases the psychological feeling of pain.
Okay, I understand.
So it's a very, very supple, very flexible tool, and you need to take advantage of it because the patient being in control is much more, um, you know, psychologically comforted.
Mm,
Always
mm.
that
No, absolutely.
psychological element. I say psychological, but the homeopathic medicine itself will work. But on top of it, you have the control on the pain because the risk of side effect is extremely low.
Yeah, absolutely. So no, that actually sounds very appealing, and I'm sure a lot of my patients would benefit, and I'm sure patients world over would benefit from that kind of thing. So no, that sounds really cool and interesting. So then talking about slightly, I mean, you mentioned inflammation and those kind of things there earlier. In terms of when we draw it back to the athletes and sporting side of things, now is there would you say is there an application in alleviating, say, post-exercise soreness or that kind of thing, enabling a higher quality training, that kind of? What's your thoughts on that?
Yes, to stay in the realm of sport, the French soccer team is treated with homeopathic medicine. The main one is arnica.
Mm.
So you give arnica to decrease delayed onset muscle soreness. Uh, of course, those are athletes, so they have to push themselves very hard in order to experience muscle soreness. But anyway, you can give arnica 5 pellets before the sports session, and then regularly every 30 minutes when there is a break, 5 pellets of arnica also to decrease not only the muscle soreness, but sometimes also the swelling, uh, especially in case of trauma.
Hmm.
Arnica works also very well on bruising. So
Yeah.
in contact sports, that decreases the swelling and bruising, increases the comfort. We have also medicines that seem to increase the metabolism of lactic acid.
Oh.
So you go the extra lap, you do the extra set
Yeah.
by taking this type of homeopathic medicines. We have there is a combination we have in the US for leg cramps that combines a homeopathic preparation of lactic acid, arnica, and some zinc to reduce the risk of cramps as well.
Mm, mm.
You also have homeopathic medicines that are targeting tissues. So, for example, if an athlete has a sprain, we have a medicine called Ruta graveolens, and this targets tendon and ligament. So systematically, every time there is a strained ligament, there is a sprain extension, we give this medicine, 3 times a day for a few days until everything goes back, and they work really well.
Okay. So obviously, injury cases, there's a limited time period of when you're required to use homeopathic medicines. Now, if it's more like if it's a more training and competition enhancement, is that something that is then just done throughout the season, throughout the training season,
Yeah,
or
those,
forever?
yeah. So two aspects. First of all, homeopathic medicines are non-doping. So even if you compete at very high level and you can take those medicines, they are not in the doping list, so they are completely okay. The second is you have most of the time athletes understand which medicine is for what, and they say, okay, I have a bruise, swelling, a bump, I'm taking arnica and so on. Sometimes with the help of a skilled homeopathic physician, you can go into more chronic problems. Especially, for example, if you have an athlete that has a little, sometimes has to overcome a tension, psychological tension, or if you want to make sure that the night before they're completely rested, they have a good night. We have homeopathic medicines for this aspect of the treatment on a more chronic, on a more extended period of time. There is no problem for an athlete to take a homeopathic medicine on a long period of time, provided, of course, it's indicated and it does what it's supposed to do. If it doesn't
quite.
work, if the condition changes, then we need, of course, to reassess the situation.
Quite right. So, I mean, one thing, you mentioned about the stress and strain, and I'm sure like a lot of people have had over the last couple of years a lot of stress in their lives, and now, of course, the situation is going quite crazy here in Europe as well. Is that something that would benefit most people in terms of coping with stressful situations in their lives?
Yes, and in fact, the advantage of homeopathic treatments in stress or sleep disorders is that they do not affect your ability to react against the stress. That means you're not numbed, you're not drowsy. If you have to take a good, as I said, you have stage fright before going into the ring or what, well, I don't know, but any sport event, you certainly don't want to take anything that makes you drowsy or limits your
Oh, quite.
vigilance. So that's where homeopathic medicine is perfect, because you tune down the physical symptoms of stress, like sweaty palm and trembling and feeling tense. I'm a musician, so before playing, the last thing I want is trembling or being drowsy. So I take the medicine for stage fright before, without any problem. It
Yeah.
beats beta blockers, I would say.
Yeah, quite.
So
No, I mean, again, something that I think there's that is an important little point for us to differentiate here is the sort of typical pharmaceutical medicines and how they are different from homeopathic medicines. So, I mean, indulge me for a second, but my understanding has always been that, say, there's the pharmaceutical medicine is very much like a sledgehammer approach, where it just hit it as hard as you can and it will do something. Whereas a homeopathic medicine, as far as I understand, is more like a gentle turn with a screwdriver. You keep turning until it's right. You don't hit it with a hammer. Is that appropriate or very wrong?
let me give you another analogy. Imagine that your body is like a country, and this country is invaded by another army. You can certainly use bazookas, tanks, and whatever to repel the army, and sometimes it's necessary. So sometimes a good physician will use the conventional medicine appropriately, give the dose that is necessary, not always the hammer. However, those drugs have side effects, and they are meant really to have a powerful, usually anti-something effect, antibiotic, anti-inflammatory, and so on. And many times it's perfectly appropriate. But homeopathy will work on a different way. And to keep the analogy, that's homeopathy will give you the blueprint of the intelligence, where the enemy is, and how to subtly do something, increase the capabilities of your soldiers to understand and react faster, not necessarily giving them more powerful weapons, but teaching them how to use them more intelligently. So I like this analogy because homeopathy stimulates your own resources. So you go through your disease faster and with lesser symptoms,
Oh, okay.
as
So
opposed
it's
to conventional medicine, which are made to really decrease the symptoms that sometimes are useful. when you cough, it's useful because you expel something. But
Yes.
sometimes it can keep you awake at night. A homeopathic medicine will speed up the transition from a dry, hacking cough into a productive healing cough.
So it's not necessarily so much an antibiotic, it's more like a pro-healing kind of thing.
It really stimulates the capability, as long as you have these capabilities, to overcome the cause of the problem to a certain extent, because homeopathy has limits. There are cases where you should not use homeopathy because we have better tools for that. It's a tool in the toolbox. It's like if you don't have a Phillips screwdriver in your toolbox,
Quite. Then you have to make one.
you have
Or
to
use the hammer.
you have to find a way.
Yeah, quite. No, I quite like your analogy there. That was actually spot on, and definitely can understand it. No, that's great.
So what is important is to say that we should never oppose conventional medicine, conventional treatments, and homeopathy. Okay, they work hand in hand. Sometimes one is better than the other, sometimes the reverse, but there are tools in the toolbox, and you need to know when to choose the right tool. That's all.
No, quite right. And the same, I suppose, can be said with chiropractic treatment as well. And of course, if somebody comes in with a sprained ankle that needs to be reset before you can do anything else, of course, a physical treatment at that point is appropriate. But of course, when you reinforce it with fine homeopathics, I guess the healing process will just take place so much quicker and produce a better result.
Yeah, you have examples. It's always, of course, anecdotal, but there are. If you look at PubMed, there are more than 6,000 references of clinical studies on homeopathy. So there is research done all over the world, but so many times, I have calls of doctors saying, "What did you give my patient?" Because he was supposed to swell after the surgery, and there is no swelling. And I say, well, it probably took arnica, so the swelling is really reduced. All the healing process goes exactly as planned, but the first phase of inflammation, where you have swelling and pain, which is a necessary phase for the healing to occur, this phase is much more comfortable, shorter, but more comfortable for the patient.
Oh, brilliant. No, that sounds great. Good. Hey, so any particular other applications for the athletes that you could shed some lights on at this point?
For the athletes, I would say the Boiron Medicine Finder is a good start. It's of course it's in English, but I would say start with this because you can cover most of your needs: stress, tension, digestive issues, of course, trauma injuries, and so on, without any risk of delaying the treatment of a more serious condition.
Good.
Now, for chiropractors, I'm going to put a link in the chat because I just finished designing a training specifically for them. That's why I can talk more easily about that, because I spent 4 months developing that interactive online training.
Wow.
So there are 4 modules.
There is the link now in the chat. So please, everybody, go and have a look, check it out, and I'm sure it's going to be amazing. Can you give us a little sneak and explain a little bit of what it does and what it's all about?
So 2 things. It's interactive and online, so you can do it at your rhythm, and you learn how to. There's a didactic part where you listen to videos, but they're short. But the most of the training is about games, quizzes, reprocessing, and case studies. That means a patient that comes to you with the symptoms, and you need to go through and find the appropriate treatment, and you get feedback. So it is a really hands-on and interesting and engaging training, and it's quite simple. And we cover consolidation of fractures, trauma, arthritic pain, sciatica, vertigo, what else? Tics, and much more.
Oh,
But
wow.
the most common pathologies that you see at the chiropractors are in the first 4 modules of this training. We'll add more later, stress and sleep, and enlarge to less more general pathologies. But we started with the one that you're more likely to see, like physical reeducation, physical therapy, things like this.
That sounds absolutely amazing. No, thank you for sharing that, and I believe that's all there, ready to rock and roll for all of our viewers and members to take advantage of and educate themselves on homeopathy, as well as how to now further help their patients and athletes. But yeah, you totally beat me to that. I was going to ask you about the sports chiropractic specific now thing. So essentially, with this education, is there would that enable a chiropractor to comfortably recommend remedies then to their, the homeopathic medicines to their patients? And or is there further kind of education required?
No, we designed the training for any chiropractor to start recommending as soon as the module 2. Module 1 is about the basics, about dilutions, about the choice of the frequency, about the principles of homeopathy and advantages, limits, and so on. The second module is right away. You have a few medicine, you know what they are doing, and you know how to choose according to the patient's main symptoms and how the patient expresses the symptoms. So right away after, I would say 1 hour and a half, you already have 5 or 6 medicine that you will never forget.
Oh, wow, amazing.
So it means to be very, very practical. No
Good.
philosophy, nothing. It's okay. This is, if you have that, this is how you do it.
Oh, amazing. No, that sounds like something that even I could learn.
I'm sure.
No, fantastic. Hey, listen, I think we're running out of time. I know you're a busy man, and I need to let you get on with your day as well. So thank you very much for joining us, and thank you for your explanation expertise on the show. I really appreciate you taking the time to talk to us. And obviously, Fix is proudly supported by Boiron. So all of our members, everybody watching, please check out the link, because that will be absolute gold dust in your practice, helping athletes and helping all patients. So thank you very much, Dr. Merville. Really has been a pleasure to meet you, and thank you for your expertise.
Thank you. And if there are questions we can address, of course, forward them to us. We'll give more details, maybe more personalized things. If someone is looking for something peculiar.
Absolutely.
But thank you for having me.
That's my pleasure, and I'm sure I'll bump into you at some point for real.
Anytime. Anytime.